Welcome to Lesson 4 of the Captain Surgery, CPC Exam Preparation 2026 series from KS Medical Coding Academy. Our topic for this lesson is surgical guidelines and documentation. In surgical coding, knowing medical terminology and finding a potential captain code are only the beginning. A CPC must also understand the guidelines, instructions, and documentation requirements that support accurate code selection. In this lesson, we'll learn where to find applicable surgical guidelines, how to recognize important parenthetical instructions, and how to determine whether the documentation actually supports the captain code being considered. We'll also discuss an important distinction between captain guidelines and Medicare-specific NCCI policies, so that payer-specific rules are not mistakenly treated as universal captain rules. Our central principle for this lesson is documentation plus captain descriptor plus guidelines right pointing arrow accurate code selection. As always, we'll use the current 2026 CPT code set and applicable official guidance throughout this lesson. Let's begin Lesson 4, Surgical Guidelines and Documentation, 2026. Before we begin Lesson 4, let's review what you'll learn in this lesson. Our first objective is to understand the role of captain surgical guidelines and why they are important when reporting surgical procedures. We'll also learn where applicable guidelines and instructions appear, including the importance of parenthetical instructions. Another major focus is documentation. As a CPC, you need to determine whether the documentation actually supports the service and whether it matches the complete captain descriptor. We'll also make an important distinction between captain guidance and Medicare-specific NCCI policies. These are not interchangeable, and payer-specific rules should not automatically be treated as universal captain rules. Our main CPC focus is documentation plus captain descriptor plus guidelines right pointing arrow accurate code selection. This lesson is designed for educational and CPC exam preparation purposes. It is not a substitute for the official captain codebook, payer instructions, or professional coding guidance. For 2026, always verify the current captain code, descriptor, official guidelines, and applicable payer requirements before coding professionally. The CPT 2026 code set is effective January 1, 2026, and CMS's 2026 NCCI policy manual is also effective January 1, 2026 for applicable Medicare policies. So keep this principle in mind throughout the lesson. Know the guidelines. Check the documentation. Code with confidence. Now, let's begin Lesson 4. Why do surgical guidelines matter? Because finding a procedure name or CPT code is not enough. CPT guidelines and instructions provide additional direction for correct reporting. The documentation tells us what was performed, while the captain descriptor and guidelines help determine how that service should be reported. A common CPC trap is thinking, the procedure name matches, so the code must be correct. Not necessarily. Always remember, documentation right pointing arrow captain descriptor right pointing arrow guidelines and instructions right pointing arrow correct reporting. For Medicare, applicable CMS NCCI policies must also be considered. Your CPC memory is simple, descriptor plus guidelines equals read together. Where to find surgical guidelines? Now let's look at where to find surgical guidelines in the captain code set. When you're working through a surgical coding question, don't stop as soon as you locate a code. CPT provides guidelines and parenthetical instructions that can give you important direction for reporting the service. A useful way to navigate is to start with the surgery section, then move to the appropriate subsection or system, locate the relevant heading or code family, and finally review the specific code. But once you find the code, there's one more important step. Read the descriptor, guidelines, and instructions together. Look for section guidelines, subsection or heading guidelines, parenthetical instructions, cross-references, add-on code instructions, and separate reporting instructions when applicable. Here's the CPC memory. Find the code right pointing arrow, look around the code right pointing arrow, read the guidelines right pointing arrow verify. A common CPC trap is thinking that finding a matching code means you're finished. You're not finished until you've reviewed the applicable instructions. For 2026, always use the current captain code set and official guidelines. The AMA identifies the current captain professional edition as the official captain codebook containing current codes, descriptors, and guidelines. So remember, don't just find the code, find the rules that govern the code. Now let's look at section and subsection guidelines. One important point for CPC candidates is that captain guidelines are not limited to the individual code descriptor. Guidelines can appear at different levels within the CAPTAIN structure and may provide direction for a group of related procedures. A useful way to think about the structure is surgery section right pointing arrow system OR subsection right pointing arrow heading OR code family right pointing arrow specific CAPTAIN code right pointing arrow descriptor and applicable guidelines. Section or subsection guidelines can help explain terminology, clarify coding conventions, describe how related procedures are reported, and identify circumstances that affect code selection. They may also explain when a service is included, when additional coding may be appropriate, or how a group of related codes should be interpreted. Here is the common CPC trap. A guideline that applies to one section or subsection should not automatically be applied to every surgical code. Always determine which guideline applies and what procedure or codes it governs. For 2026, use the current CAPTAIN Professional Edition and current official guidelines. For Medicare reporting, CMS's 2026 NCCI Policy Manual provides additional Medicare-specific guidance, but NCCI does not replace the CAPTAIN guidelines. Remember this CPC sequence. Section right pointing arrow subsection right pointing arrow heading right pointing arrow code right pointing arrow read the guidelines. The key rule is simple: don't read the code in isolation. Read the code with the guidelines that govern it. Parenthetical instructions. Now let's focus on parenthetical instructions. Parenthetical instructions are important CAPTAIN instructions that can clarify how a code should be interpreted or reported. They may appear before or after a code listing, or within a code descriptor. You may see instructions such as, see another code, use another code, do not report separately, use an additional code, or a cross-reference to another procedure. These instructions can change the direction of your code search. For example, a parenthetical instruction may direct you to another code for a particular approach or tell you that an additional code should be considered. Here is the common CPC trap. Don't skip the parentheses just because you found a code that looks correct. The instruction may tell you that another code is more appropriate, an additional code is needed, or the service should not be reported separately. Your CPC memory is: find code right pointing arrow read parentheses right pointing arrow follow instruction right pointing arrow verify. For 2026, always use the current CAPTAIN codebook and current instructions. CPT parenthetical notes can be updated or corrected, so current year verification is important. For Medicare claims, CMS NCCI guidance may provide additional Medicare-specific reporting instructions. The key takeaway is simple: when you find a CAPTAIN code, don't stop. Read the parentheses. Now let's focus on one of the most important principles in surgical coding. The documentation must support the code. When reviewing an operative report, first identify what procedure was performed. Then determine where it was performed, including the anatomical site and laterality when applicable. Next, identify how the procedure was performed, including the documented approach or technique. Also look for the extent of the procedure and any other details specifically required by the CAPTAIN descriptor. Then compare all of these details with the complete CAPTAIN code descriptor and applicable guidelines. Your basic workflow is: document right pointing arrow match right pointing arrow verify right pointing arrow code. Here is the common CPC trap. The procedure sounds like the code, so I can report it. Not necessarily. Never fill in missing documentation simply because a particular code seems likely. The selected code must accurately represent the service that was actually documented. The AMA explains that CAPTAIN codes have detailed descriptors and guidelines for their use, and the current CAPTAIN Professional Edition is the official source for those rules. For 2026, always use the current CAPTAIN code set. If Medicare reporting is involved, CMS's 2026 NCCI Policy Manual provides additional Medicare-specific coding policies. So remember, don't assume. Read the documentation, match the descriptor, verify the guidelines. That is how accurate surgical code selection begins. Now let's compare documentation with the CAPTAIN descriptor. The operative documentation tells us what actually happened during the procedure. The CPT descriptor tells us what a specific code represents. Our job as coders is to compare the two before selecting the code. Start by asking: what was performed? Where was it performed? How was it performed? And what extent or other details are documented? Then compare those details with the complete CAPTAIN descriptor. Ask yourself: does the procedure match? Does the anatomical site match? Does the approach match? Are all the requirements of the descriptor supported? Are there any applicable guidelines or instructions? If the documentation only sounds similar to the descriptor, that is not enough. The AMA states that a captain code should accurately describe the procedure or service performed rather than an approximate service, and the full descriptor and associated guidelines should be assessed. For Medicare coding, remember that CMS's 2026 NCCI policy manual provides additional Medicare-specific coding policies, and CMS emphasizes that correct coding remains the provider's responsibility. Your CPC memory is: documentation right pointing arrow match descriptor right pointing arrow check guidelines right pointing arrow verify right pointing arrow CODE. The key rule is: documentation tells you what happened. The CPT descriptor tells you what the code represents. Your job is to make sure they match. Now let's bring together three important layers of surgical coding review: CPT guidelines, documentation, and NCCI policies. First, captain guidelines provide coding direction within the captain code set. Second, documentation tells us what service was actually performed and supports the code we select. Third, NCCI policies may affect code reporting when Medicare applies. A useful workflow is: documentation right pointing arrow captain descriptor right pointing arrow captain guidelines and instructions right pointing arrow NCCI, if applicable right pointing arrow VERIFY. Here is an important CPC point: NCCI is not a replacement for the captain codebook. NCCI is a Medicare program designed to promote correct coding and address inappropriate code combinations in payment. CMS also explains that NCCI does not contain every possible correct coding combination. Therefore, the absence of an NCCI edit does not automatically mean that a code combination is correct. For 2026, the Medicare NCCI Policy Manual is effective January 1, 2026, with separate surgery chapters covering the major surgical captain ranges. So remember, captain tells you how the code is defined. Documentation supports what was performed. NCCI may affect Medicare reporting. And your CPC memory is: document right pointing arrow descriptor right pointing arrow guidelines right pointing arrow NCCI if applicable right pointing arrow VERIFY. Always use the current captain codebook, current guidelines, and applicable Medicare policies before finalizing your coding decision. Now let's focus on an important 2026 special point: always use the current guidelines and policies. The 2026 CPT code set became effective on January 1, 2026. The AMA reports that the 2026 code set includes 288 new codes, 84 deletions, and 46 revised codes. This means CPC candidates should not depend on an older codebook or assume that a previous year code remains unchanged. For 2026, remember to use the current captain code set. Verify the current code descriptor. Review the current captain guidelines and instructions. Pay attention to new, revised, and deleted codes. And never assume an older coding example is still correct. For Medicare reporting, CMS's 2026 NCCI Policy Manual is effective January 1, 2026 and includes surgery chapters covering the major surgical captain ranges from 10,000 through 69,999. Remember, NCCI is Medicare specific. It should not automatically be treated as a universal captain rule. Your 2026 coding check is: current captain code right pointing arrow current descriptor right pointing arrow current guidelines right pointing arrow documentation support right pointing arrow NCCI, if applicable right pointing arrow VERIFY. And your CPC memory is: current code right pointing arrow current guideline right pointing arrow current policy right pointing arrow VERIFY. The key takeaway is simple: 2026 coding requires 2026 resources. Always work from current references and verify before making your final coding decision. Let's look at a common CPC scenario. The coder finds a captain code that appears to match the operative report, but does not review the applicable captain guidelines or parenthetical instructions. The coder also assumes that because there is no NCCI edit, the services can automatically be reported separately. That is the trap. No NCCI edit does not automatically mean correct reporting. CMS states that NCCI does not include every possible correct coding combination. For the CPC exam, remember, documentation right pointing arrow captain descriptor right pointing arrow guidelines right pointing arrow NCCI if applicable right pointing arrow VERIFY. The key memory rule is: no edit does not equal automatically correct. NCCI is one part of the coding review, not the entire coding review. Let's summarize Lesson 4, Surgical Guidelines and Documentation. First, remember that Captain guidelines provide important direction beyond the individual code descriptor. Always review section and subsection guidelines, and never skip parenthetical instructions. Next, make sure the documentation supports the specific service being reported. Compare the documentation with the complete Captain descriptor and applicable guidelines. For Medicare, review NCCI policies when applicable, but remember, no NCCI edit does not automatically mean correct reporting. For 2026, always use the current Captain code set, current guidelines, and applicable payer policies. Your final CPC workflow is documentation right pointing arrow Captain descriptor right pointing arrow guidelines right pointing arrow NCCI if applicable right pointing arrow verify right pointing arrow CODE. And remember the final rule, don't just find the code. Understand the documentation, guidelines, and rules that govern its reporting. That completes Lesson 4, Surgical Guidelines and Documentation, 2026.